I do a lot of therapy, as I said, and what is so fascinating is, and I don't know, it's just a phenomenon I've seen with this, but people come in after being on the micronutrients, and they say they feel whole again. They have their life back. You know, I used to see people coming back and they'd say, yeah, I feel better on the Zoloft, but, I feel kind of dulled. And these people are saying, I feel completely different like I've never felt before. And when you get, people that have chronic illnesses like chronic bipolar that have gone from just surviving day to day and wondering when they're going to cycle down next to realizing that they can actually move out of their house, get a job. On a therapy-wise, there's a whole set of rich work that you can do. Another fascinating thing that I found working with the micronutrients and getting people off of these medications from a therapy point of view is they're finally able to process their feelings and feel on an emotional level. So they will come into your office and they're crying and and opening up, and I'm going, oh my God, are they depressed? Do I have to stop the Empower, put them back on Prozac? What am I, And then, then I think, okay, take a step back. This is true process work that they haven't been able to access because the medications have put a damper on those level of emotions that they were not able to access. And I thought, this is a good thing. So, so you're kind of juggling a lot of different things. Is it process? Is it depression? Is it, anxiety from, pockets that are being released of the medications? So it's a lot. It's a bigger picture to keep in mind and take a look at and to really be on top of with these patients. But, it's just been, fabulous to see the differences in these patients. I finally have people coming back saying, my life has changed. I never heard that on people just on medications. So I'm happy to report that my patient is doing phenomenally well. He is, I had to write to his teacher, explain the situation. They had him help with the course. He is out of his house. He's doing well with his parents. He has a new girlfriend that doesn't give him Klonopin. He is for now 6 months maintained on 15 Empower. Goes 12 to 15 to 20 sometimes on the total aminos. The parents are on the EMPowerplus and the total aminos, and it's helping their relations. So I'm telling you, there's something about it just helps lift issues of trauma and dysfunction and people's issues. It's just an amazing thing. I've had people come in, put them on these medications, and they say, I'm just feeling better. I've suddenly been able to just let go of all this pain and anxiety I had over my ex-husband. I said, really? God, great, okay. This makes my job a lot easier. So I don't know. I don't know what that is. It may do something with a different part of the brain that's able to unlock where that's stored in the brain. I don't know. It's something to look at. More research questions for sure. But anyway, Nicholas is doing great. He's in college, got a B average, is off medications, on no illicit drugs. Really has his life back, and the family is in one piece.